Calcific tendonitis is a painful disorder. This is a 56-year-old female diabetic patient who has had recalcitrant tendonitis of the shoulder. She has had a previous injection into a calcific deposit. However, this has still remained painful for her. Because of this, we decided to debride it utilizing the arthroscope. Here we're looking into the subacromial bursa on top of the rotator cuff tendon. The calcific bodies typically present in the supraspinatus tendon. The first job that we have to do is localize the deposit inside the shoulder. We use a combination of radiographs as well as palpation and needle localization to try and identify the deposit. We first felt a hard area utilizing the shaver. We've now introduced a spinal needle into this hard area to try and see if we can find any of the calcium. We make multiple stab holes until we start to see a crusty white material. This is the appearance of calcium within the shoulder. Now we can start to see some of the calcium coming through the supraspinatus tendon. The next step will be to enlarge this area to try and remove as much of the deposit as we can. Once the area is enlarged, we will insert an arthroscopic shaver, which is done here, to try and suck away and remove as much of that calcium deposit as we can. Care must be taken not to make too large of a hole, as this is going through the rotator cuff tendon. However, should this be done, we can always repair our hole with a suture. We now have a large enough hole where we've been able to insert the shaver underneath the rotator cuff tendon. The shaver blade is then moved back and forth to try and circumferentially remove the calcium deposit. This is a good view of what the actual calcium looks like. Some people liken this to toothpaste. However, this is what causes the pain for the patients. In addition, a portable radiograph machine can be utilized intraoperatively to make sure that all the calcium has been removed, and this was done in this particular case as well. A final probe is used to make sure that all the calcium has been removed. The shoulder is then irrigated and suction dry.